Hello, this is Dr. Gay from First Look MRI, and this is a 17-year-old male who had a recent injury and felt a pop in his knee, has knee swelling and pain, and he has a very straightforward classic finding. And we're going to see this on a coronal view to start with, and then we'll go to an axial view next. So on this coronal view, we're looking straight at the knee, kind of like an x-ray. You can see the femur up top, the tibia down below. If we go off to the side, there's the fibula to get oriented. So this is the outside of the knee, inside. And a couple findings here that really stand out is this fluid, which is bright over the medial joint line. And we also see something over here on the lateral side. We see marrow edema of the femur, but it doesn't extend beneath the articular surface. This is the articular cortex, that black line. Here's the tibia, there's a meniscus, and there's that marrow edema. So it's above the joint line. We see it as we go forward. It's more anterior and above the joint line, and this is related to impaction with the kneecaps. This is a classic pattern of marrow edema. You see this? You know that's got to be patellar dislocation. I guess it could have a direct impaction injury, but this is just a classic look. So transient patellar dislocation, the kneecap dislocated, smacked into here, pop back to normal position. We get a little bit of cortical depression sometimes like this. It's concave rather than outward convex, underlying marrow edema. If we roll forward, we see something on the medial side. This is a little fragment, a little chondral fragment from the kneecap floating over here. Sometimes they can have osseous fragments, sometimes chondral fragments. Something we need to look for, so when they do surgery, they can go fish that out. And now we're going to go forward to see the kneecaps. This is the patella. The superior and lateral contours are normal, but look at that inferior medial contour. It's, again, impacted. The bone is impacted with underlying marrow edema, and we can see this best on the axial sequence. So the next is the axial sequence. We can see the patella up front. We can see the defect of the patella. This cortex is the black line. It comes down here, and then it's impacted by about 5 millimeters. Right here, impacted. We see the underlying marrow edema and the articular cartilage, which is the gray band here, this thick gray band. Superficial to that black cortex. Nice, normal. Here's the apex and the medial facet. Here, the articular cartilage is severely abnormal. So this little chondral fragment came from here and flipped over. So just a classic case of a transient patellar dislocation where the kneecap impacted, came back to normal position. They have a displaced chondral fragment that they need to take out. And also they have a tear, which happens usually of the medial retinaculum. This is the retinaculum, this black line. It attaches to the kneecap here, and it is torn off the kneecap. And there's a bright band here. This is partial tearing. Some of the fibers are probably hanging on there, but partially torn. And also the retinaculum comes over here to the medial collateral ligament. And it looks like it's torn here as well, and a little bit of fluid is leaking out underneath that tear and going along the medial joint line. A little bit of a sprain of the medial collateral ligament, which is right here as well. So common findings, very classic example, and that's it. Thank you so much.